This is the VOA Special English Health Report. An American program called the President's Emergency Plan for AIDS Relief helps millions of people infected with HIV. PEPFAR is considered one of the most successful programs created during the presidency of George W. Bush. Its goal was to change HIV/AIDS from a death sentence to a disease that could be treated. And for millions of people around the world, that is just what happened. But researchers say it was not until PEPFAR started using generic drugs that major progress was made in fighting HIV/AIDS. Generic drugs are copies of medicines developed by large drug companies. They often cost a lot less. Researchers from Brown University in Rhode Island studied the effectiveness of PEPFAR. Kartik Venkatesh was the lead author of a report about it. He says the high cost of patented antiretroviral drugs influenced the program after it began. American officials considered whether to provide patented drugs to HIV-infected patients both in the United States and overseas. Dr. Venkatesh says some people believe that the drug industry wanted the government-financed program to use patented drugs. But generic drugs were shown to be effective in treating HIV as long ago as 2003. Using generic drugs helped cut the cost of treating a person from about $1,100 a year to about $300 a year in 2005. PEPFAR has also been able to save millions of dollars by reducing transportation costs. For example, the program uses ships instead of airplanes to move drugs. Dr. Venkatesh says the PEPFAR model could be used to fight other diseases in developing countries. It could help the developing world deal with health problems that until recently had only been seen in richer countries. Dr. Venkatesh says more and more people are understanding that chronic diseases could represent much larger health care costs in the future. Problems like cardiovascular disease, diabetes, and cancer will require long-term medication. He says a lot can be learned from the experience with PEPFAR and the use of generic drugs to treat HIV. The Brown University researchers have proposed creating a plan for what they call the efficient and transparent purchase of generic drugs. Planners would include the United States, the World Health Organization, and generic drug manufacturers. For VOA Learning English, I'm Laurel Bowman.
This is the VOA Special English Health Report. A new study suggests that dental x-rays may increase the risk of the most common kind of brain tumor. However, experts say the risk of these mostly non-cancerous growths is still very small. The study compared about 1,400 patients with a brain tumor called a meningioma to a group without brain tumors. Dr. Elizabeth Kloss of Yale University led this study. She says it found that those with the tumors were about twice as likely to report having had a common kind of X-ray called a bite wing. The link was greater with the kind of imaging called a panoramic X-ray. There was up to 5 times the risk, depending on age, or how often the x-rays were taken. Dr. Klaas points out that in this study, the people were generally in their 50s or older. They were asked to remember x-rays they might have had many years earlier. So there is a chance they might have underreported or overreported how many dental x-rays they had. Dr. Klaas says she does not want to scare people away from dental visits. In her words, the big take-home message is keep going to the dentist, but have a conversation with your dentist about whether you might be able to reduce the number of x-rays that you receive. Her research paper appears in the American Cancer Society's journal, Cancer. During dental procedures, and even when people brush their teeth, mouth bacteria often enter the blood system. A popular belief is that gum disease can lead to heart attacks. But the American Heart Association recently published a statement saying there is no scientific proof. The statement, appearing in its journal Circulation, says gum disease has not been proven to cause heart disease or stroke. And it says treating gum disease has not been proven to prevent them. There is also not enough evidence to know whether brushing and flossing regularly can prevent heart disease. A committee of heart doctors, dentists, and infectious disease specialists considered 500 journal articles and studies. They say there is not enough evidence at this time to confirm a cause and effect relationship between gum disease and heart disease. Both diseases are often found in the same patient. But the experts say this is possibly because of risk factors common to both diseases. People who do not pay attention to risk factors like smoking, diabetes, or high blood pressure may not pay close attention to their oral health either. For VOA Special English, I'm Carolyn Presutti.
This is the VOA Special English Health Report. For medical students, real experience begins not in a classroom, but at a teaching hospital. These doctors in training are supervised, but sometimes accidents happen and the students get injured. For example, they might stick themselves with a needle while treating patients. Such needle sticks are common, but a recent study found that medical students often fail to report them. Failing to report an injury like this can be dangerous if a patient or a medical worker has an infectious disease. Researchers at Johns Hopkins University in Baltimore, Maryland, did the study. It involved a survey answered by almost 700 surgeons in training. These surgical residents were at 17 medical centers in the United States. Almost 60% said they had suffered needle stick injuries when they were in medical school. Many said they were stuck more than once. Yet nearly half of those whose most recent incident happened in school did not report it to an employee health office. If they had, they would have been tested to see if they needed treatment to prevent an infection like HIV or hepatitis. Most known cases of HIV or hepatitis are reported, but other possible infections often are not. Martin McCary was the lead author of the study. Dr. McCary says medical students who are stuck put themselves and others in danger from infectious diseases. Doctors in training may have to do hundreds of stitches in some cases to close the skin after an operation. Dr. McCary told VOA's Melinda Smith that he supports using blunt tip needles, which are considered safer. He said this kind of needle is still sharp enough to go through body tissue, but it has a blunt tip, so that if it accidentally goes into a finger, it is much less likely to perforate. How common are needle sticks among healthcare workers? An estimated 600 to 800,000 of these and similar injuries are reported each year in the United States. But Dr. McCary says the real number may be much higher. The study advises doctors to protect their hands by wearing 2 sets of gloves. It also urges hospitals to establish a special telephone number for medical workers and students to call if they are injured. The idea is for hospitals to send a clear message that there is no reason not to report this kind of accident. And that's the VOA Special English Health Report.
I'm Alex Villarreal with the VOA Special English Health Report. Every year, 1 million women around the world are found to have breast cancer. Almost 200,000 others are told they have ovarian cancer. The decisions for treatment are more difficult when the women have abnormal versions of 2 genes called BRCA1 and BRCA2. The mutations in these genes can also increase the risk for other kinds of cancer, including cancer of the cervix, uterus, and pancreas. Sandra Cohen has never had breast cancer or ovarian cancer, but she has the BRCA1 and BRCA2 mutations, so she decided to have doctors remove her breasts and ovaries. She made the decision after her mother and grandmother both died from the same kind of cancers. Doctors have known for several years that preventative surgery reduces the risk of ovarian and breast cancer for women with the mutations. But a new study also shows that these operations help those patients live longer. The 4-year study involved about 2,500 women with the genetic mutations. One of the researchers was Dr. Susan Domchek at the University of Pennsylvania School of Medicine. She said women who had their ovaries removed had a decrease in the risk of breast cancer and a decrease in the risk of ovarian cancer. In addition, they were less likely to die of breast cancer, less likely to die of ovarian cancer, and also had an improvement in their overall survival. The study found that none of the women who had preventative breast removal developed breast cancer. 7% later did among those who decided against the surgery. The rate of breast cancer was also 7% among women who did not have their ovaries removed. Among those who did, the breast cancer rate was 1%. The study also found that the women who had their ovaries removed lowered their risk of death from ovarian cancer by almost 80%. Their risk of death from breast cancer was 56% lower, says Dr. Domchek. The researchers say women with a strong family history of breast or ovarian cancers should get genetic testing. Sandra Cohen did. She says, do some research with a genetic counselor. Meet some other women who have gone through it. It really will empower you to take some action. The study appeared in JAMA, the Journal of the American Medical Association. For VOA Special English, I'm Alex Villarreal.
This is the VOA Special English Health Report. President Obama has signed legislation to make the biggest changes in the healthcare system in 45 years. The president said, "Today, after almost a century of trying, today after over a year of debate, today after all the votes have been tallied, health insurance reform becomes law in the United States of America." Many parts of the plan will fully take effect in 4 years, but some take effect quickly. For example, in 6 months, the new law will bar insurance companies from denying coverage to children with pre-existing health conditions. Adults with pre-existing conditions will be added in 4 years. The government will help millions of people pay for insurance. It will also permit millions more to receive free coverage through the Medicaid program for the poor. In all, the plan aims to make health insurance available to 32 million people now without it. People will be able to buy private policies through marketplaces called exchanges to be administered by the states. Illegal immigrants will not be able to take part. An estimated 83% of people under age 65 who are in the United States legally now have insurance coverage. The plan is expected to raise that to 95% within several years. People over 65 are covered by the Medicare insurance program, which the government created in 1965. For the first time, Americans will be required to have health insurance or face a yearly fine starting in 4 years. The law will also require companies with more than 50 employees to offer coverage. If not, they could face a fine of $2,000 a year for every worker. Also, this year the law will start closing what is known as the donut hole. That is a lack of Medicare coverage for some drug costs for older Americans. President Obama promised senior citizens that the reforms will not cut their guaranteed benefits. The Senate quickly made a last set of legislative fixes needed in the new law. However, some states have already gone to court to fight the new health care reform law. The health care plan is expected to cost about $940 billion over 10 years. But it is also expected to help reduce the federal budget deficit. And that's the VOA Special English Health Report. You can comment on this story at our website, voaspecialenglish.com.